Hey everyone, and welcome back to Quick Medical Review. In this episode, we are going to talk about Wolff-Parkinson-White Syndrome, commonly referred to as WPW Syndrome. This is a condition that can lead to serious heart rhythm disturbances if left untreated. Let's begin by exploring the basics. It is a cardiac condition characterized by abnormal electrical conduction due to accessory pathways connecting the atria and ventricles. This results in pre-excitation of the ventricles and a predisposition to arrhythmias. The syndrome's prevalence is approximately 0.1 to 0.3% in the general population and is slightly more common in males. Risk factors include congenital heart defects such as Epstein's anomaly and in rare cases, genetic mutations like PRKAG2. Patients often present with palpitations, dizziness, or shortness of breath. In more severe cases, they may experience chest pain, syncope, or even sudden cardiac death. During physical examination, clinicians should evaluate for signs of tachyarrhythmias and congenital abnormalities, such as Epstein's anomaly. Asymptomatic individuals may be diagnosed incidentally during routine ECG screenings. Diagnosis begins with a 12-lead ECG showing hallmark features like a short PR interval and delta waves. Further risk stratification may involve exercise testing, which can reveal intermittent pre-excitation, or an electrophysiology study to assess accessory pathways properties. Echocardiograms are useful for detecting associated structural abnormalities. Management depends on symptomatology and risk assessment. Symptomatic patients typically undergo catheter ablation, a highly effective procedure with minimal risk. For acute arrhythmias, vagal maneuvers, adenosine, or direct current cardioversion may be employed. Asymptomatic individuals require risk stratification to determine the need for ablation, especially those in high-risk occupations or with high-risk accessory pathways. Antiarrhythmic drugs, such as flecainide, may serve as alternatives in selected cases. The most severe complication is sudden cardiac death, primarily due to rapid ventricular conduction during atrial fibrillation. Catheter ablation significantly reduces this risk. Other complications include recurrence of arrhythmias and, in rare cases, procedural risks associated with ablation. In summary, WPW syndrome, though potentially serious, is manageable with early diagnosis and appropriate intervention. Always refer at-risk patients to a cardiologist for specialized care. This wraps up our discussion on WPW syndrome. Thanks for tuning in to this episode of Quick Medical Review. I hope our talk on WPW syndrome has been helpful. Be sure to subscribe and join us next time for another concise medical review.